Thanks for listening to the Granite List.Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement.
And welcome back to another episode of the Granite List.Live. I'm Lee Dill, and I'm pleased to be joined by Jessica Landin, CEO of Vori Health. Jessica, thanks so much for joining us today.
Thanks so much for having me. Great to be here.
Absolutely. And we'll just dive right on in. You've recently been appointed as CEO of Vori Health. Congratulations.
Thanks so much.
Tell us a little bit about your background and how you got here.
Sure. Well, I've spent about 20 years in healthcare operations and growth. And I've really spent my career scaling innovative care models that are designed to improve access and patient outcomes. So Vori was a great fit because that is exactly what Vori was built to do. Before Vori, I spent time as the chief operating officer of a company called Dispatch Health, which is another innovative company, an in-home emergency room and hospital alternative care national practice. And before that, I spent almost 10 years at a company called Evolent Health, who was a pioneer in value-based care, where I helped build their value-based care services division and later co-founded an internal startup called Evolent Care Partners, which was a national primary care risk business within the Evolent portfolio. I've also spent time working in a large health system, building regional alliances and some of the early value-based care programs, and also in the cardiology space. But I'm excited to be here at Vori working in MSK and again, helping to scale an innovative care model designed to bring access and improved outcomes.
You absolutely have a lot of experience to take Vori Health forward. Give us a little background on what Vori Health does. Why are they different?
Sure, absolutely. So Vori is a virtual first hybrid medical clinic. And what I mean by hybrid is we do have an in-person presence for patients who need that, but we are virtual first. And we serve patients with musculoskeletal conditions who are looking for a more conservative care pathway, a non-surgical solution to help with their pain. What makes Vori different is that we have a multidisciplinary team, but we're led by MSK physicians. So there's lots of different approaches to MSK and conservative care pathways within MSK out in the market, but we are the only solution that is actually led by MSK physicians as part of our multidisciplinary team. And our goal is to treat the whole person. We really want to address and treat the cause of pain without rushing to things like high cost imaging or surgical interventions that are often not needed when the true cause of pain is really addressed. And so our team includes MSK physicians, physical therapists, exercise physiologists, health coaches, and dietitians so that we can really address the full spectrum of why someone may be experiencing MSK pain.
Walk me through what that might look like, because I'm sitting here thinking about my own personal, pain issues of after having children. Do you stand up and say, well, my hip hurts right here or my knee hurts right there? How are you able to, explain the pain virtually?
Absolutely. Well, just like if you were in a brick and mortar clinic, most of our patients start their journey with us first by filling out some intake forms, just like you would if you're going to a normal doctor's appointment. And then within the first visit, it is a telehealth visit. If you've ever had a telehealth visit, you show up on screen and you're greeted by either an MSK physician and a physical therapist, or in some cases, depending on severity, maybe just a physical therapist for that first visit. And they're going to walk you through a series of evaluations and assessments, both asking you questions to understand what's been going on, how your pain started, what your pain involves. And then they're also going to do a functional assessment. So just like you kind of alluded to, they are going to have you stand up, show them how you move, point to where the pain is, and they're going to assess both the medical cause of your pain and the functional cause. So they can do that by watching you go through a series of simple exercises and stretches that are related to your pain to really assess what's going on and ask you questions as you're doing those things. So very similar to how it would happen in person. They're just watching you from the video.
Very cool. And so you do have a hybrid model. So if somebody does need to go in to be assessed physically, there's an opportunity to do that.
Absolutely. Yeah. If occasionally patients may have trouble with technology, we do try to troubleshoot when that happens, but maybe someone is less comfortable, they need to go in person. Or if a patient prefers to have some of that manual intervention live and in person, we can usually accommodate that. And some patients may just need that little extra hands-on help during the course of their treatment. So we are virtual first. We keep seeing a patient through our primary care team, but with our hybrid in-person solution, we can accommodate patients that need a variety of different situations to help get their pain improved.
Great. So you've been with Vori Health for a couple months now.
Yes.
What are some of the opportunities you've identified as potential growth areas?
Sure, absolutely. Well, I think from a capability standpoint, we're really focused on growing our core chassis. We've got a great clinical solution. We are having a great impact on the patients we serve and helping our client base really drive cost savings. And I think one of the things that we are hoping to grow into is some of the value-based care opportunities in the space. So taking our solution that is already having a great impact in MSK and some of the adjacent areas that we touch, women's health, bone health, and counseling for various causes of MSK and chronic pain, and taking that not only out to employers whose employees can benefit from the solution as part of their overall healthcare, but also working with health plans that are active in value-based care. So we're starting to see that value-based care MSK programs can expand access for patients, provide an alternative care pathway from traditional orthopedic or MSK care, and can offer a ton of value to patients, not only because our programs are convenient and accessible, but also because we can produce really great outcomes for patients. And so we think that there is a big opportunity to grow into more value-based care programs, not only with our employer clients, but also with health plans, and particularly in the Medicare Advantage population.
Tell me a little bit more about your self-care program.
Sure. Well, again, we try to meet patients where they are and provide as much access as possible. So some patients, particularly those that may be more tech savvy, may not have a serious medical diagnosis cause of their MSK condition, may be able to find relief through a self-managed care program. And so what that means is that they would log on to our platform, they would engage with their care plan independently. We have motion tracking sensors that can track them as they do their exercises, which they can choose to do or not. And that can give them feedback if they need to lift their arm higher or bend deeper as they're doing their exercise. It helps them along in the program. One of the things that Vori is investing in right now is adding AI assistance to some of our self-managed care programs to make it even more interactive and more engaging for patients that are doing exercises independently on their own time and maybe not engaging in live care with a clinician. So really both ways of care are available, and most patients will do both. They will meet with their clinician live, and then in between those live sessions will engage in independent care through our platform. And then some patients will only engage with the self-managed care because they either don't need escalation to the clinical care team, or they've already had a clinical care team involved and they have moved on to maintenance on their own.
Well, having that AI component involved too, and is it a video? So they're watching you do these exercises and tweaking how you're doing them?
So today, the self-managed care platform is a series of video exercises. And then there is a motion tracking function that can watch you. Essentially, it's a camera, it's a video as you're doing the exercise. You don't have to turn that feature on, but you can. And then in the future, we're hoping that some of our platform enhancements using AI will actually create a more interactive opportunity for patients to engage while they're doing their exercises.
I mean, I think that's great though, because so many times you can hurt yourself or think you're getting better, but you're just doing things wrong.
Absolutely. And that's why we also encourage our patients and our members to engage with the clinical care team, doing work on your own and then checking in with your care team on a regular basis so that you can have that feedback and that live interaction to make sure that you are progressing in your treatment plan is super important.
Okay, so we talked about AI and how that's going to affect every area of our lives, including physical therapy. What are some other ambitious long-term visions you have for the company?
Sure. Well, I think, first and foremost, we want to be a leader in virtual MSK care and MSK care in general. We think that our solution is applicable broadly to patients that are experiencing pain, which we know that MSK pain is one of the leading causes of disability worldwide. And so lots of people at any point during the year may experience an MSK condition. And we want to be a household name for people that are seeking care for their MSK pain because we are confident that we can help them get better.
Amazing. And then looking at the current market that you service right now, what is a major industry trend that you believe is overhyped or one that's dangerously underrated?
Yeah, well, we just talked about AI and I want to be careful with this. Don't get me wrong. There's a ton of very promising things that can be done with AI, and we are incorporating AI into our care platform and deploying it as one of the tools in our toolkit. We think that AI can drive more efficiency for operational processes. And excitingly, as we just discussed, it can really help strengthen and enhance our clinical programs and patient engagement and the patient experience. But I think where we want to be careful is around what AI won't do, which is it's not going to replace physicians and actual medical care. And so, I think the winning combo is where AI is incorporated into the clinical solution. We're pairing the clinical solution with AI as a reinforcement tool. And that's where I think we'll see the most impact across healthcare.
So you touched a little bit on this already, but what are some of the other differentiators you're seeing in the marketplace? We know there's tons of musculoskeletal solutions out there. What is special about Vori Health?
I would say our clinical model, and it's great. And if you haven't experienced it, definitely encourage you to do so. But our big differentiator is that we are truly physician-led. And we have a large in-person network for that hybrid solution where patients need it. So we're the only physician-led multidisciplinary care team solution in the space. By being a medical group, we're sort of this one-stop shop for patients more than a lot of the point solutions out there. So our care teams can prescribe meds if needed. We can close gaps in care. And though we are a conservative pathway and we don't do this often, if a patient does need imaging, we can order that imaging. So we have all of the capabilities of a traditional medical group in a virtual first hybrid solution. We also have the robust in-person network that I mentioned that operates under the direction of our physician-led care team. And so for patients that need an integrated and connected combination of virtual and in-person care, we can help get them the best results. So truly the integration and coordinated care that our solution and our medical group setup offers is truly differentiated in the space.
That's great. Share with me, what are you hearing from your clients, from the members that you serve? Can you share some of that feedback?
Yeah, absolutely. Well, I think it's no surprise that lots of patients and clients that we serve really praise the convenience of the model. We can typically get patients in within 48 hours of requesting an appointment. So really great access where, depending on where you live, it could take weeks to get in with a specialist or a physical therapist. So really high praise for our access. And then every day we're flooded with stories from patients who have worked with our care teams that just continue to tell us how we've helped improve their life. We've gotten them back to their daily activities. And in some cases, we've helped them beyond what other things they've tried have done. And so taking the time to listen and be fiercely dedicated to addressing the cause of their pain and helping them get back to the things that they love to do in life. And so we love to hear those stories and, of course, know that we're having an impact on patients.
You can tell you're really passionate about what you do, and Vori Health should be excited to have you lead them forward. Before we wrap up, I want to know one thing that you're most looking forward to as Vori continues to expand in the market.
I think being able to expand our impact, help more patients, drive more value to our employers and payer partners, and hopefully driving more people to understand that conservative care for MSK can be as good or better than traditional pathways and can help get you feeling better with fewer risks and less pain, and in a lot of cases, less cost. So just really excited that we've got a great solution and look forward to expanding our impact and helping more patients.
And if anybody is interested in bringing your solution to their health plan, where should they go?
They can go to our website, VoriHealth.com, and there's contact info, and we would love to hear from you.
Well, awesome. Well, Jessica, thank you so much for joining me on another episode of the Granite List.Live.
Thanks so much.
Thank you for listening to this episode of the Granite List.Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.